a second. All right. Hello, everybody. As you can see, this is fun. So I'm going to give you a little bit of a glimpse into my life. It's been quite the ride, so buckle up. So this is my lovely husband who could not be here tonight because somebody's got to stay with the child. So he's on daddy-daughter duty for the weekend. Okay, so we're going to start with my diagnosis, and then we'll kind of work our way through. I actually have notes on my diagnosis because, honestly, I don't remember it. I was 6 years old. I am 42, I think. It doesn't matter. Roughly. So it was a long time ago. So I'm just going to refresh my notes here. Okay. So in 1980 was when I was born. It's a lovely year. I have an older brother, David, or Tom, and a younger brother, David, and me. The only girl. I turned very colicky very quick. So I had an older pediatrician who had seen over 5,000 children. They kept switching formulas, and we got through it. I was always thin and short and small for my age. At age 6, I got a stomach virus for 1 week. Taken to the pediatrician and examined. Second week, went to the emergency room. I was seen by a psychologist, psychiatrist, neurologist, and the list goes on. They told my parents I had everything from mental problems to not wanting to go to school. When all in all, it was not bad. On day 8, it was no better. And then I was sent to St. Christopher's Hospital for Children. On visit 1 here, they did 5 different tests: EKG, blood tests, CAT scans, ultrasounds, psychological scans. All of these were done, and the blood finally came back elevated ammonia. Dr. Grover was his name. That was the man that diagnosed me at the age, that was 1986. I then met with the department that would be taking over. I was under Dr. Rizvani and Dr. DeGeorge, if anybody knows that name. There's a syndrome after him. He honestly was like my second dad. His voice, as soon as I got to the hospital, he would get off the elevator, I would hear his voice, and I'm like, he's going to fix me. Everything's going to be okay. That's all I had to know. I'd also like to mention how amazing my mom was. As a mom now, I don't think I could do half the things that she did. Weighing all the food and measuring, and I have enough as it is with just a regular child. It doesn't have any. I can't imagine that kind of stress already onto it, minus other children too. And my older brother was terrible sometimes. And when I started, it was at 6 grams a day. So I'm an adult now, obviously, and I'm at 40. So, I mean, 6 grams, that's like nothing to me. Finding orphan drugs was a lovely challenge. There was no social media. So, and the Orphan Drug Act was actually came in effect. I don't remember what year exactly, but I know we fought to get that. Today, I'm here, me, and I have my husband at home. My daughter is also at home, and I'm going to show you some slides. So this is me in Nashville. It was like my dream vacation that I finally got to do. I went last April, which is ironic. So I'll just move out of the way. My mom, my dad, my mother-in-law, my father-in-law, and that is my dear Madeline, who was a preemie and was adopted from birth. She's my little miracle child. She was only 4 pounds when I got her. We'll just say that she's thickened up a bit. So I'm going to talk a little bit about pregnancy and family planning. Family planning is something I'm very, very passionate about because I had a pregnancy that was really, really difficult. I had a pregnancy that started normal around 10 weeks. I had they said it was severe nausea, but at this time now I know it wasn't. I was hospitalized the entire time of my pregnancy. And to come to find out that the baby was a boy and he was affected. And they basically gave me a choice of, who do you want to live? Nobody should have to make that choice. And I don't think I would have made it out of that hospital, like, intact cognitively. So obviously we chose to end our wanted pregnancy. That's the way we choose to say it. And that is how I landed into adoption, which is kind of weird because I always wanted to adopt anyway. And my husband's adopted also.
Oh, wow. Full circle.
So it's like a full circle moment.
Full circle.
And then, so adulthood and navigating healthcare. What part do you want me to talk about on that? I can say it's definitely challenging. I mean, getting a doctor that has both pediatric and adult patients is probably the best thing you can do as an adult, because I learned the hard way that they don't want to touch you at the children's hospital unless it's just OTC. That's it. And OTC affects everything. So that was hard. And I learned that during pregnancy too. Like, they don't care. Navigating healthcare, I think, is really important. I always have, like, my advocate with me, and my dad likes to say, like, the squeaky wheel. He's really loud and obnoxious sometimes, but I love him to death, and he's taught my husband pretty well. And my mama bear over there, who also, she still does mama bear stuff, right, at the airport. So the airport was a very interesting scenario. So I've had OTC since I can remember. And I've traveled many places. Not, it's not my first rodeo. So I go to the airport. I had already passed TSA. So TSA was completely fine with my luggage and my medication. The lady at the the airline was like, "Oh, our plane is, like, going to be full. Any luggage we need to check." And I was like, no. Can't check this. So I go up there, and I was just trying to politely tell her, I cannot check this. Literally, it's a bag, and all it has is medication. Literally. There's nothing else in that bag. She wanted me to take it all out and give her an empty bag, which I find utterly ridiculous. And she wouldn't listen to me. She wouldn't read my letter. Like my medical letter? Yeah. My disability card.
Oh my God.
Like, I have my disability card. Like, she didn't care. So I had to get her supervisor involved. And apparently and I was like, I never had a bad experience before like that. And I was like, you know how embarrassing that was for me to have to, like, I mean, I'm not embarrassed, but I can imagine a younger person that this is all new. And they don't want to have to pull out all their medication in front of everybody. It's already awkward enough that and then I was like, you can't see it. That's why. Like, it's a disability. Just because I don't have, like, a wheelchair or something. They asked me if I had medical device. Like, at that point, I wish I did. Yeah, but I mean, she just did not want to read the letter and was not going to acknowledge anything I had to say. So at that point, you have to go higher, because I'm like, I know my rights, and something as a young Kristy, I would have been like, whatever, like, I wouldn't have fought it. But I'm like, now I'm like, oh, that's not the law. So that was interesting, to say the least. Of all trips, this one, like, I went to Nashville last year. No, they didn't care. Did the same thing. And so I don't know if it was the lady or the airline or what.
It's probably the lady.
The lady had a.
Good for you standing up to yourself. I know. Good for you. You knew your rights. Water.
So this is my dear Maddie.
Oh my gosh, precious.
She is the best thing that ever happened. I thought this was a kind of cool picture. This is the last picture I can know that I remember. So this was in DC.
It's in Washington, D.C.
Yeah. And I remember this because I don't know if you were there.
Yeah, very tough. Straight dress.
So it was 2018.
2017.
This one? But I thought it was kind of cool because it kind of, yeah. And this is like my daily life, toddler, you know, Daniel Tiger, Baby Shark, that kind of world.
Yeah.
And that's about it. Does anybody have any questions? Or can you have a question?
So tell us how, when you were talking about an advocate, you said you always have your advocate with you for doctors and for insurance. So tell us a little bit about that.
So I always have somebody with me, especially when I go into a healthcare facility. Usually it's my dad or my husband. And I've learned the hard way that going through an adult hospital, they don't like parents. They're like, you're an adult. But I have it written out that they can make decisions, basically. Because if I'm not cognitively okay, I shouldn't be able to just make a decision. Mm-hmm. You wouldn't want me to drive, would you? So why should I be able to make a decision like that? So, I mean, my husband, we're on the same page. We're on the same team. We kind of know. But I think going in there strongly and advocating and knowing that, like, he has paperwork that if you need it, like, fine. Okay. But even if it's a parent, especially a parent if they have an adult child, because that's quick to come, that cutoff, they're like, oh, they're 18. You have no say whatsoever. Mm-hmm. And when you're not all feeling right, that's not a good idea. I think it's always a good idea to have a legal document that says that somebody else can make decisions or sign on your behalf. Because
have you found that it works? People do rehab here? Okay.
They usually do. And my doctor, particularly, like, she's like, what she say goes. She knows her best. Listen to her parents. Listen to her husband. Like, and she doesn't live in the same state. But, like, she's in a different state than I am. So she's, like, doing the care through a different hospital. And it works fine. But just being adamant about that, you know, you're allowed this. They're not doing you a favor. Like, it's your rights. Is there anything else?
Any questions from families that are newly diagnosed? Kristy is an expert when it comes to how to navigate, you know, the transition from parent care to taking care of herself and some of the challenges that come around with that.
Yeah.
Then I'll ask, from your perspective, what do you think helped and didn't help in that transition, as far as when you were a teenager and you were trying to have control, but trying to also have the benefit of an advocate with you? What do you feel like was the balance that worked for you?
I'm trying to think. I mean, I had control about, like, food. Let's be honest. Food. I don't think my parents were real strict on what I ate. It was just, they just wanted to make sure I was eating something. So that's kind of like the fight those battles. Like, what is it? Now I kind of understand because I'm in the parent role now. Some battles are just not worth fighting for, and some are. Obviously, keeping them healthy, getting their nutrition, whatever way that works for them. I found it to be very particular to the person. For me, like, I have no G-tube. I never did. I took everything by mouth. I didn't have a choice. They didn't offer G tubes when I was little very much.
What was the first drug that you were on? Were you on sodium benzoate in the beginning?
I still am, actually.
Okay.
Yeah.
Today?
Mm-hmm.
Wow.
Yeah.
And that's like, do you like it? Is
I-
it, you
It's
know?
fine. It just,
Wow. I just thought that they,
I mix it with Coca-Cola.
Of course.
And this is how my mom got me to take it.
You're such a slave. That's awesome.
She used to like put some in a cup and put it in there. And if I drank it, I got the rest of the soda. Winning.
Oh my gosh, I've never considered trying that. And
Or
my
cream soda's a good one.
won't take medicine. Oh my gosh.
Cream soda's also a good one. Nothing.
I just got a few questions. Sodium benzoate is the drug we used before we had anything else. So I would say 24 years ago, we got butanol. If anyone's ever tried butanol, it is the most foul
It's
drug
disgusting.
there is. If you have butanol at your house, don't taste it. You'll feel like your mouth is on fire.
It's
And
for
then we did the trial and helped develop Ravicti. Ravicti took away the awfulness of the butanol. But for some people, Ravicti alone is not the perfect solution. So depending on your case and your doctor, and depending on fluctuations, benzoate could be used as something to help maybe in an emergency situation, or maybe you just need a little bit of extra help. But benzoate is readily available, very inexpensive, and is being used across the world in areas that do not have access to Ravicti or butanol.
and it's been in your food for years.
It's
Like
in the soda, actually.
When you pop a soda,
Yeah.
that fizz, that
The light
steam
zone.
when you drink, that's benzoate. And so there were cases many years ago where there were undiagnosed female adults walking around that didn't know they had OTC, but they drank a ton of Tab Cola. Tab Cola has the highest amount of sodium benzoate,
Is that
and
right?
they loved it. They were addicted to it.
I
Just
love
because it made them feel better. So the more they drank, the better they felt, and they didn't know that. And then once they were diagnosed, it was this, what do you eat, what do you drink, and they all said Tab Cola.
Oh my God, I love cola.
Yeah, and Tab Cola, I don't even know if it's still on the market anymore.
I don't know, but I love soda.
Wild. I have a question. So the list of medication you just named, at what age did she have to begin with? Because Kingston's
So everyone's urea cycle disorder is as unique as your thumbprint. And everyone's variant, your mutation is all different. So my daughter had a severe variant of OTC. Before we could get her diagnosed, she was, we almost lost her a few times before she was diagnosed at 14 months. Without medication, she would not have survived. There are other families that medication is not needed at this point, depending on the variant. And we've done a lot of research. You'll hear tomorrow, Dr. Amy Dudley has done a yeast model on the OTC variant. And we know that we have a huge spectrum. We have no symptoms at all, but you have the variant. And then we have the most severe, which was my daughter, and which this is something, she's not in here, so I'm gonna, if she was in here, she'd say, don't say that. She's
Say
not
it later.
here. So the whole time that Lexi was young, we tricked ourselves into believing that she was a mild or moderate mutation of OTC because that felt better. It felt better. It helped us sleep a little. I knew she was a little more severe, but when someone would say, tell us about her mutation or tell us about how severe she is, I would say, she's moderate, knowing that that wasn't the full truth. She got a transplant, and life has been much, much better for her because she wasn't stable for a long time and we could not keep her stable. So a transplant was something that we needed to do. Hi, Dr. Lecter. But we took Lexi's DNA and we compared it to the yeast model. And I was on a Zoom call. I probably shouldn't have done it this way, but I was talking to Dr. Dudley and I said, hey, I have Lexi's mutation. Can you check it for me against your data set? She was like, yeah, send it to me. I sent it to her in the chat. And she looked up and she goes, 0. And I said, what's 0? She says, Lexi's enzyme activity was 0. She was the worst case possible. And as a parent, I went 2 places. I went, dear God, that poor child. We pushed and pushed and pushed. And then I went on look what we did. We got her all the way to 19 years old, but it was everybody is different. And so I think that is probably the hardest message to convey to families.
Yes.
You can't compare my journey, Kristy's journey, Lexi compared to Kristy, completely different. And I can look around the room and see different families that I know. Everyone's journey is different. And so there's a baby in Singapore right now, probably will not need medication. Probably for a while. Right now, okay. And unfortunately, the only thing that is available is sodium benzoate, but we know that it does work. It's not I don't know that any prescribing doctor, Dr. Odom, would any prescribing doctor prescribe sodium benzoate as the first?
Well, you might do it if you're running into insurance issues with like Ravicti, and obviously you want to avoid using dental butyrate as much as possible.
Absolutely.
I don't know. I know they have the coated ones now. I don't know if you would have any experience with that, but I'm hesitant. But I mean, you might for various reasons.
Yeah, but it's not the top shelf that you would choose. Most families, most doctors would choose that Ravicti, but there's some nuances to using Ravicti as well. Every medication has side effects and benefits, and you have to weigh the benefits to the side effects and see what works best for you.
So that's sodium benzoate the first option?
It was the very first option.
It was the only
It
option.
was the only thing we had. 20. We have patients that were diagnosed 35, 40 years ago, and sodium benzoate was it. And then we advocated for butanol and helped develop butanol. And it was just, it worked, but it was so foul that you couldn't get anyone to take it. So then we went to G-tubes because that was the only way you could get the medication in was through the G-tube. No, most will not drink that because it's just
Okay, so I'm a little confused because I guess it depends on the DNA, what level, even if you need that sodium benzoate.
Yes, so it's all based on how much your liver is working. So with an OTC variant, Kristy's was working much more than Lexi's was. And so Kristy's, her dosage was much lower than Lexi's. Kristy's ability to eat protein was much higher than Lexi's. Stress would affect Lexi probably more than it would affect Kristy at the time. So that's why it's all individualized, and thankfully now we can do more individualized medicine because we now have all the DNA. And so anyone in the room that does not know their DNA mutation, talking to Dr. Dudley tomorrow afternoon would be great. She could really help with that. She has them all memorized. If you said your code, she'd go 30. But be prepared for what she could say, because I wasn't.
To clarify, that's for OTC.
That is only for OTC, but Dr. Dudley is working through all. She has made a serious commitment to work through all of the urea cycle disorder conditions. She has done partial citrulline. She's working on ASA. So she will get it done for sure. And when you hear her present tomorrow, she's infectious and she is all in. And I'm so glad we found her.
Oh, I love her.
Yes, she is just great. Any more questions for Kristy?
I have a question, just like transitioning to adulthood. So you made a remark earlier about your mom, like weighing everything out. We're kind of in that stage now. Like, how did you like take ownership of that going forward? Like, did you start giving yourself meds and taking care of your diet in high school, or was it like how did that work?
No, more like in your 20s.
20s is really when I grasped the reality of it, that like, this is mine, this is my responsibility. Like no one, like I was only going to feel the effects if I didn't do what I was supposed to be doing. And my doctor at the time is the same doctor I have now. And she's like, yeah, you gave me like all of my gray hair that time. Like, because it was normal, like rebellious things, but I feel like you have to go through that too. I didn't have like, in high school, it wasn't very, I was really sick in high school. So I didn't have like a normal experience in high school. So I kind of was late. But I think like once I got the routine down and got like what I was doing, it was more the medications, like making them on my own. My dad still makes the date like each day's worth for the month. I don't want to take that from him. I could probably figure out how to do it, but he's content with that. So like little things like that. Nowadays it's so easy with protein because there's a phone in your hand, so you just can look up whatever you need. They didn't have that when I was a kid. So that was the harder part. Was she had a book that had all the protein in it.
Yep, we had a book.
And a scale, and it went everywhere with us. Everywhere. Yeah, and the scale. And I actually still have the scale, and now it's at my house just for memories.
Are you allowed to eat right now?
Am I allowed to eat?
Yeah.
How much protein? 40.
40.
Oh, 40.
49.
40 on a good day.
40 in a good day.
Yes, but hormones are not my friend.
And that's a whole nother study, Kristy being 39.
I wish.
For women that transition, we have not really looked at that and done any research on what that means. I know many, many years ago, and again, Lexi's not here, so we'll say this. She was 11. We were at the NUCDF conference in Washington, D.C., and all the doctors were down having their UCDC meeting. And I called Dr. Brendan Lee, and I said, meet me in the hallway. And he was like, what's wrong with Lexi? And I said, she started her period. And he went, yes, that's what happens. But what does this mean? He said, it's just part of growing up. I'm like, no, what does this mean for OTC? And at that time, there was no research into it.
No.
And he said, okay, she's patient 1, let's figure it out. And so if you have a daughter that is getting close to that, come bend my ear, I'll explain. There are some nuances on things that you should be doing or thinking about. We didn't do a lot of it until we had to tweak it, but I think now it's standard practice. So when we know better, we do better. And I think for our older females, when we know better, we do better, but we're not there yet. So that still has to be, that has to be the next thing that we research. It's one thing for so many years, it was about, can we keep these children alive?
Yeah.
Then it became, can we get them to adulthood? Now it's, what is the quality of life into adulthood and for the rest of their lives? So that's the next journey that we have to take.
And everybody's journey is different. I wouldn't change nothing. I think there's a reason for everything.
Now let's ask your mom.
I know, my mom loves her grandbaby.
No, here.